Hello and welcome. I am Dr. George Best, Doctor of Chiropractic in San Antonio, Texas. And on this video health tip, I'm going to be talking about the muscles in the hip and buttock area that can produce obviously hip and buttock pain, but also pain down the legs. There's two main muscles that we're going to be discussing. The first one is the piriformis muscle, and you may be familiar with a condition called piriformis syndrome. That is a situation where the piriformis muscle itself, which runs, basically it's from the the edge of the sacrum, the triangular bone at the bottom of the spine. It runs from the edge of the sacrum out to the hip joint. So it kind of sits down in here like so. And what that muscle does is, in some cases, you'll have the sciatic nerve will actually get compressed by that muscle because the nerve may run through the middle of the muscle or underneath the muscle in some cases. So it just kind of depends on your particular anatomy, and people actually do vary quite a bit anatomically in that area. And in some cases, the muscle itself can cause referred pain. And in either case, the pain and other symptoms, which could be tingling or numbness or something of that nature, it'll run down typically the back of the thigh and then down into the lower leg. With piriformis syndrome, it tends to wrap around to the ankle. The other muscle, the gluteus minimus, is a little bit higher up in the buttock. It's going to be up in here. And the gluteus minimus will produce leg symptoms as well, but it typically is in the side of the leg. It's on the outside of the thigh, and then sometimes into the lower leg, but it really likes that outside thigh area for its symptom distribution. Now, both of these muscles can be involved, or maybe one or the other, or you may have true sciatica, which is being caused by some kind of spinal compression on the sciatic nerve. But if your symptoms have come on from either an unusual amount of physical activity, let's say you went out and did a long hike and you're not used to it, you're using those hip muscles a lot of times still gets tightened up, get knots, and you'll start to get symptoms down into the leg from that. Or it may just be sore in the hip. The other thing that can happen is if you're sitting for long periods of time and not moving around. And in that case, the muscles, because they're not moving, things just kind of tighten up in there. And a lot of times that'll start to produce symptoms as well. So let's go ahead and talk about stretches for relieving problems in these two muscles. So let's start with the piriformis. And the one I like to do for the piriformis is you're going to bring the knee towards the chest, kind of a typical knee to chest stretch, but then you're going to come across toward your opposite shoulder. So you're going to bend it across like so. And you hold it for about a 10 count. And you'll probably feel some tightness in here if the piriformis needs to be stretched. And once you've stretched the first side, it's always good to stretch both sides, even if only one side is symptomatic. Not only do we don't want to leave things uneven, but neurologically speaking, stretching both muscles will actually loosen up the tight muscle more than just stretching the one that causes symptoms. So we're going to do the same thing over here. We're going to bring that leg straight up to the shoulder, and then we're going to come across to the opposite shoulder. And again, you'll feel probably some tightness in the buttock when you do this. And you hold it for about 10 count. And it's a good one to repeat multiple times. In fact, stretching in general, if you're having some symptoms, it's good to stretch frequently throughout the day rather than just do like one intense stretching program in the morning or in the evening or something like that. It's good to do a few repetitions of this throughout the day if you are having symptoms, and that'll get things loosened up faster than just doing the stretch once or twice a day. So then the other muscle, like I said, is the gluteus minimus. And for that, we use what's typically called the figure 4 stretch. And a lot of people will say this is a piriformis stretch. It kind of depends on how you do it. With a figure 4 stretch, if you do it where you keep this knee pointing outward and don't let it come up like this, it's going to be more of a gluteus minimus stretch. If you let it come up like this, then when you start to stretch this way, it's actually going to get the piriformis more. So to get the gluteus minimus, you want to keep that leg pointed out. And one of the ways that I find is easiest to do that is if I reach kind of between my legs and grab the other leg that's being supported on, and I just kind of hold this knee pointed out with my elbow. So I just kind of put some pressure on it, and we bring the leg up as far as we can go comfortably. And again, you hold it for a count of 10 or so. And you'll probably feel this in the buttock as well, but a little bit higher up than you did with the piriformis. So then we're going to switch legs, go like so. Again, you're going to go between the legs, or have one on the outside and one on the inside of the thigh of the support leg, and keep this knee pointed outward using the elbow. You bring it up, hold for a count of 10 or so, and then you're going to relax and you can switch off. So these two stretches are really good if you've got some stuff going on in here. If you have any significant arthritis, major arthritis in the hip, to the point like where you're thinking maybe you need a hip replacement or something like that, you definitely want to be really careful with these and probably should avoid them unless it's okay by your doctor or physical therapist. It's just one of those things that if you're putting a lot of stress on the hip joint and you've got some major problems there already, you're probably just going to aggravate things. But other than that, these two stretches work really well for loosening things up and alleviating a lot of that kind of achy, sore spots in the hips, and also kind of those weird, kind of achy pains, sometimes tingling, sometimes numbness that'll run into the side of the leg in the case of the gluteus minimus, or back of the leg in the case of the piriformis. So that covers it for this video. I hope you got something beneficial out of it, and thank you for watching.